Okay, so now we're going to talk to a lovely lady who's one of my patients called Peggy, and she's just going to come up for a few minutes. And I want her to tell you what relief she got from using holistic medicine, which is really quite phenomenal in such a short period of time. So here comes Peggy. Water, yes, I know. It's hot, isn't it?
Your bottle's falling over.
I know, that's okay. So thanks, Peggy, for coming up.
You're welcome.
Now, Peggy has been a type 1 diabetic for a long time, so she has to inject with insulin. And over the years, she developed a common complication of diabetes, which is peripheral neuropathy, which meant that her feet felt on fire, like they were burning and being pricked with pins, so much so that she didn't sleep for how long, Peggy?
About 7 years.
She didn't sleep for 7 years.
Not more than 2 hours, anyway.
Yes. And so, you know, there's a lot of causes of insomnia, and pain or peripheral neuropathy is definitely a common one. So I said to Peggy, well, you got to sleep. You know, you can't live like that. You couldn't even put your shoes on, right?
No shoes, no socks. Tried to wear thongs, and even those hurt.
Yes.
Not even my bedroom slippers.
Yeah, terrible. So, yeah, it's a wonder you could put up with it.
And couldn't walk barefoot because it hurt even more on the floor.
Yeah, so you were exhausted from lack of sleep.
Yep.
Did it make you depressed, having that burning feet?
Yeah, I think that was all my depression was that.
Yeah.
To tell you the truth, yeah.
Yeah. So what I said to Peggy is, look, let's improve your diet. Now, you know, Peggy was a carbohydrate lover. And so now she's not eating as many carbs, are you? She's not eating as much bread or pasta. She's eating more protein and vegetables. And the big breakthrough for giving her 100% relief from this peripheral neuropathy was two things. First of all, lipoic acid, which is a supplement that we have here at the clinic, lipoic acid. And also giving her a cream to rub into her feet, which contained lignocaine 10%, which is a fairly strong concentration. It's a local anaesthetic with some other medications in it. It was a prescription item. It's made up by a compounding chemist. And so how long did it take to completely stop the burning?
About 2 weeks.
2 weeks.
Because we hadn't used the lipoic acid yet. We used the cream first.
Yeah.
And then the next week you prescribed the lipoic acid, and by then I was sleeping like a baby. In fact, I didn't want to wake up.
So you're sleeping like a baby. Isn't that great? So, you know, that's holistic medicine that's combining the drugs in the cream, which is much safer than taking it orally because it doesn't go through your liver, and giving her a nutritional supplement. She also takes some other things like magnesium and berberine and glycemic balance, some things to bring her blood sugar down. And she takes insulin, and they all work very well together. But we've got to tell them that funny story about how the creams got mixed up.
Oh,
that was funny. What happened, you see, the chemist, and it's not Bloom's, by the way, but it's another chemist, they sent Peggy's cream to another patient, and that patient's cream to Peggy. And Peggy's cream, as you know, makes things numb. You can't feel anything. And the cream of the other patient that came to Peggy was a hormone cream to make you feel like a woman again, you know, a bit of libido and whatever. So there's Peggy. She's rubbing this sexy cream on her feet. And there's this other lady rubbing this numbing cream on you know where.
Neither of us had the desired effect from our creams.
Needless to say, her feet got more sexy, but they were still burning.
They walked
and the other
really
lady
well after
couldn't
the
feel
cream.
a thing. And God bless the other lady. She's so sweet. Yes.
Did she come back?
She'll always come back. She's lovely. And so, anyway, we told the pharmacist off, you know, chastised him severely because that's not very good. But we did see the funny side. Yes. Thankfully,
I must say that
you had the sexiest feet in Camden for a few days.
They walked well, but they didn't feel very well.
Okay, well, thank you, darling. So you're a wonderful success story for nutritional medicine being able to heal peripheral neuropathy.